Welcome to the Integrated Hospital Network case study. As you read through the actual case document, you'll realize that this hospital network is located in a mid-sized town and serving a host of smaller communities covering a vast area. Is actually a vibrant operation. It's since inception, it's survived through all sorts of government changes, funding models, loss of staff, and challenges faced by the healthcare sector. To support your findings and your decision making around the case study, it will be a good idea to mine some data that's provided to you in this spreadsheet, see what intelligence you can gather out of it to support your evidence based decision making. Now, this orientation is about the data and how you can take full advantage of it. So, first of all, if you look, down at the bottom, you'll see several tabs. Now, the most important one is the master tab. And if you go there, you'll see an array of data. Now, this is not to suggest that you have to use all of it. There's a lot of data here. A lot of it's about hires, terminations, pay, vacation, a little bit of benefits, performance, and so on. So you pick and choose. So if you're working, for example, on the HR planning side of the case study, then maybe look at some of the data related to planning. If you're doing some compensation related things or OD or training related things, focus just on that area. So in the master tab, you'll notice that you've got several columns. So a lot of them are just simple. For example, the staff name, and this does include every staff member we've ever had since inception. So if you look at all these orange ones that have a term date next to them, they're all terminated. So most of the data mining that you will do, you want to make sure that you filter out the term dates. So you've got the location, and the hospital network has actually 5 different locations, but the executive office is actually at the central site, so it's not a physically different location. Now, you got the job title of the individual, whether they're full-time, part-time, what their pay level is. Now, if you're doing anything related to compensation, you could go down to the compensation tab and have a look at what the various clusters, the point levels, and the pay levels are, and the different jobs, okay? Again, that's optional. Now, who does this person report to? What was their date of hire? Are they terminated or not? So I included this column just so you would be able to do very quick sort of data mining just to see who's terminated, who's not. So typically, if you filter out all the yes terminations, it means that you're only looking at active employees, right? Now, the vacant code, this means that we're currently looking for a replacement. That will be a Y. No means they were terminated, we'll never replace them. Or R means that we already replaced them earlier by another employee. Now, this is the actual term date. This is the reason for termination, a variety of reasons here. Their date of birth, their gender, their pay. Now, the pay is represented in 2 ways. One is hourly, which is a wage. One is salary, which is annual. And in the actual annual column, we've converted them to reflect the annual amount. So, for example, $15.45 is equal to $27,000 per annum. This is the number of hours actually worked. This is the actual pay. So, for example, if a person worked their full year of 1,750 hours, and that sort of information is provided in this supporting information tab, tells you up here, if a person's worked a full year, then they get to keep their full pay, their actual pay. But if they haven't, we need to deduct a portion of it, right? So this is their actual age, the years of service they've been with IHN, either as full-time or part-time. Full years worked. So for example, if this is 1.85 years worked, it's 1 full year, and 0.85 represents 312 days. The actual number of vacation days that the person earns, and yes, it has been adjusted for Bill 148. The number of actual absent days that were not sick, so these are undocumented absent days, and the actual number of documented sick days. The marital status, SET, which is a service effectiveness training program that we have. And the hospital at one point realized that our service standards are not where they need to be in terms of healthcare. So people who actually were invited to the training, received it, and completed it, they would have a code C. If they were invited and they came and they failed, it would be F. If they were invited and they never showed up, that would be an N. And U means they just never qualified for it. Okay, and if it's a blank, it just means the person's terminated well before the training was ever offered, right? So Let's move on. The current PR, which is the current year performance rating, would be on a scale of 1 to 5, 5 being the best, 1 being the worst. Now you'll notice that some people don't have a rating in their current year. That's either because they were terminated before the June of the current year, which means that they have a previous or last performance rating. But if a person has both performance ratings, it means they were with us in the past and they were here this year. Now, retirement preference is more HR planning. We asked the employees, at what age would you like to retire? And most people would say 65 or 70, but some people said, 50, 55. What's your succession preference? And this means on a scale of 1 to 3, 3 meaning high, 1 meaning low, do you want to take on other higher level jobs? Do you want to be part of a succession plan? So for example, if a person says number 3, yes, I would like to take on my manager's job, then they're a high target, meaning their affinity with that job is there. They actually want to stay with the company and possibly they want to develop with us. Now, do they possess the core skills required for the next job? So for example, if you have a pharmacist and they would like to become the manager of pharmacy, do they have the core skills right now to take on that next level job? Yes or no? And what value skills do they possess, which are over the top additional skills, soft skills, hard skills that would make them a good target for development in the future? So quite foreseeably, you can have a resident arrive at your hospital, practice medicine as a general physician, and then actually move on to chief of surgery at some point, if they possess certain skill sets that would qualify them to take on those higher jobs. Now, the MPI is malpractice incidents, which is the number of incidents that doctors have related to some sort of a legal issue with the patient. PCR is the patient complaint rating. So the hospital at one point instituted a new customer feedback system where patients would say on a scale of 1 to 3, I believe. Let's take a look. Yep, 0 to 3 actually. 0 means no complaints were made for that particular employee, and 3 is that there were excessive number of complaints. Now the EEQ rating, employment equity rating, which are your provincial target groups, female, visible minority, Aboriginal, and disability. Now the last 2 columns are related to the performance system that we talked about here, current PR and previous PR. So did the actual person doing the performance ratings receive performance rater training? So this is specialized training that actually educates the rater on how to give performance ratings. So if you imagine the average boss, the supervisor, whose job does not involve rating, they were never trained for it, it will be very subjective to some extent, full of bias possibly. So did they receive the training, yes or no? And the last column is what is the lag time between communication of a performance rating process to the supervisor and the supervisor actually completing that review for HR to record. So if it's taking 30 days for a supervisor to get a rating in, there might be some issues with the system. So take some time to go through the data, make yourself familiar with the different columns, and ask yourself, what part of this data can I use to support any decision that I am proposing in my case study? And you'll be surprised how you'll find some correlations between one or the other variable. You'll be able to see trends and patterns as well. Now, down at the bottom, there's a supporting information tab that just gives you extra information that might be helpful. For example, a description of each column, some codes that you might need to know, the number of hours, that sort of thing up here. If you go to the vacancies tab, you'll see information about only the vacant positions at IHN currently. So in the master tab, you've got all the jobs we've ever had, or all the positions that we've ever had since the inception. However, there's a number of these that haven't been filled yet. So if somebody was terminated and we wanted to replace them, who are they? So if you go to the vacancies tab, these are the actual jobs, okay? So there might be number of positions for each job. For example, for King General Physician, we have 3 positions, right? That's the pay budget for them, and that's a date that they were requisitioned. Now there's also some supporting tables over here to help you kind of make some decisions around this. Now the recruitment and selection tab takes 2 of those vacant jobs, security for Central and general physician for King. So we need 4 security officers hired and we need 3 general physicians that King hired. And it gives you some information of when the requisition was signed, when we sent the posting out, and few candidates that actually applied from different sources and so on. So we did hire. The greens are the ones that were actually hired. So you can do some sort of recruitment selection metrics around here. Now the RNS tables tab at the bottom shows you some information that might be helpful in terms of costing out your recruitment selection practices as well. Okay. Now there's one last tab that you might or might not use for this exercise. It might maybe in the future, but it's a good idea to have a look at it, and it's compensation, which is breaking down the various jobs into clusters and point values at your job evaluation, and actually giving you the mid and the maximum point so you can have a look at the midpoint. So however you use this, it's entirely up to you. If part of your case study is to propose a new compensation or total reward system, then dabble in some of this or make some sort of recommendations, because it's quite possible that you might have a turnover issue because of compensation. You don't know. See, over here you've got the vacation entitlement table, which is Bill 148 compliant, but maybe you realize that to retain more people, you might need to up the number of days starting at maybe 12 and up this to about 13. So these are just micro decisions that you might make, but this data is all there, and there's a lot of different information you can actually use to support your decision making with actual evidence. Take some time and get one person on your team that is data mining expert, so to speak. Collaborate, do some charts, do some graphs, and I think your final document and your presentation will actually come alive and support what it is that you're writing in your actual submission. Okay, so have fun with it.